Under several Republican proposals to revamp the health care system, one thing has become abundantly clear. Cuts to Medicare would be drastic. Patricia Villone joins us now to discuss this and how this would affect statewide and locally and what kind of impact it would have on folks. Patty, what do you have?
Well, we've heard a lot about whether or not there should be a tax cut on the wealthy or not in order to bring in some of the moderate or the conservative GOP on the plans for the healthcare system reform. But what we don't hear an awful lot about is a very important federal program. And right now, quite a few people are being silent, and we want to tell you a little bit about that program, Medicaid, which usually is thought of as the insurance program for the poor, but it also has been used as a way to help those between jobs who have lost their health coverage. That was the case for Bonita Spikes, a nurse who learned she had Alzheimer's before her position was eliminated. Spikes is worried that if Medicaid is cut, she won't be able to afford her prescription drugs.
It would be catastrophic for me because I have Alzheimer's, and on the medication I maintain pretty well, and off of it I'm just afraid of how fast I would deteriorate. So it's a very big fear for me to think about not being able to afford my meds.
Well, Spikes is one of tens of thousands who could lose their coverage if any of the GOP versions of insurance reform pass. Maryland's Healthcare for All Coalition is concerned about the potential impact on residents and the state.
About 75,000 Prince Georgians will lose their health care. About 5,000 jobs will be lost. About $2 billion in federal funding will be gone. And hospitals in Prince George's County, their uncompensated care budget will go up by about 50%. What this means from a practical standpoint in Prince George's County is that the business model to make the new hospital viable will dissipate because it was based on the premise that the Medicaid expansion from the Affordable Care Act would continue, that uncompensated care would be down, and the numbers would work out, and this would blow all that out of the water.
Now, under the Better Care Reconciliation Act, Medicaid expansion created through Obamacare would be phased out. So those receiving coverage through the expansion could once again be without insurance. And I just want to go over those numbers again. He said $2 billion, that's with a B, $2 billion lost in federal funding for the state. That could mean about, nationwide. And then that would be about $500,000 here statewide. And 75,000 people could be without health insurance here in Prince George's County. Very big numbers.
Yeah, I was just about to say that. But in addition to those numbers, the monetary costs, you were also telling me that about the human costs.
Yes, and that's why it's really important, because a lot of people, there's a stigma to Medicaid. A lot of people don't want to talk about that, and that's not to be compared to Medicare, which is for seniors and those who are older. Medicaid has had, unfortunately, a stigma attached to it, and it's very important to hear from people like Bonita Spikes and hear their stories. Not the time to be silent.
Exactly.